Good morning. Today I would like to reflect on one of the main topics taught in CSB346 Transition to Professional Paramedic Practice. The topic I decided to reflect on is experiential learning and clinical debriefing. Experiential learning and clinical debriefing are important processes that I have and will utilize throughout my paramedic career and within my clinical practice. My definition of experiential learning is the process whereby knowledge is created through transformation of experience, while clinical debriefing can be defined as an important strategy used in learning to detect and to improve performance. It is the comprehensive evaluation of these actions that can lead to improved practice and subsequent patient outcomes. As I progress to the formal phase of my paramedic career, it is essential that I master clinical debriefing and embrace my own learning style. This is to ensure that I can provide the highest standard of emergency treatment, patient care, and transport. Paramedics are exposed to unpredictable situations, which leaves little room for error where mistakes are inevitably made. Most jobs attended to by paramedics present differently. More than often, the call-out details what is expected. It doesn't normally match what is found, which leaves the paramedic to act on instinct and using background knowledge. I have come to realize that I learn more effectively through active engagement and concrete experience. According to Kolb's theory, this infers that I have an accommodating learning style. The accommodating learning style involves doing and feeling. This is a hands-on approach which relies on intuition rather than logic, which in a high stressful situation as a paramedic, intuition will take precedence over logic, as I find myself in a stressful situation more than sitting back analysing and creating the most logical approach for treatment and transport. I fall back onto instinct. Kolb's experiential learning cycle involves seeing a person progress through a 4-stage cycle. These 4-stage cycles include concrete experience, a new experience of situation is encountered, reflective observation of the new experience. Of particular importance are any inconsistencies between experience and understanding. Abstract conceptualism. Reflection gives rise to a new idea or a modification of an existing abstract concept. Active experimentation, where the learner applies them to the world around them to see what results. Therefore, it is essential that I continue to invest time towards OSCEs, ensuring my first experiences are encountered in more of a controlled setting, but obviously that has many limitations associated with it. In addition to providing a process for experiential learning, Kolb recognises the importance of individual learning styles and how each different style acquires to learn. Over the past decade, research shows that simulation has predominantly been used to train healthcare professionals and students. Research clarifies that simulation-based assessment and training, if used effectively, can result in positive outcomes. Throughout the last 3 years of university, simulation-based scenarios were completed in almost every tutorial. Each tutorial group was broken up into evenly small groups. Most tutorials had about 3 different scenarios, For each different scenario, 2 students were selected to act as first and second officer. After completing each scenario, as a group, we would debrief and give feedback. Research shows that simulation training alone is not sufficient. Simulation training in conjunction with oral feedback ensures a higher quality of training. It is the role of feedback and debriefing that enables the learner to integrate their learning experience. Students weren't interrupted throughout the simulation activity, and they were giving the feedback after completing the scenario, which in these situations would be talking about transport and handing over to the nurse at the hospital. That's when the scenario would be finished. When giving feedback, the first question asked to the student was, "How do you feel you went?" I felt that this facilitated self-evaluation, which is essential to reducing the emotive impact of feedback. Facilitating self-evaluation will also promote the student to function in a reflective mode in their daily practice. However, we all hold bias in the way that we judge our own performance. I believe that I am my own worst critique. But self-evaluation relies on the student to be self-aware and effective at critiquing their own performance, which is a skill that's not always present. Self-evaluation alone is inadequate for performance improvement. It needs to be facilitated by skilled educators who can change their questioning strategy appropriately to ensure students' understanding. Following self-reflecting, a group discussion took place, allowing other students and the tutor to give feedback. From here, strengths and weaknesses of the performance were discussed with further investigation to the consequences of their actions and treatment. And if they were to do it again, what would they do differently? How would they change their treatment? And if their treatment is effective. I love getting feedback. I feel as though it can give me more areas to think and reflect on, enhancing my knowledge. Research shows that specific feedback can maximize and produce long-lasting learning. These simulation opportunities provided to be valuable learning experiences and gave me the chance to apply theoretical knowledge. I felt as though feedback given in the tutorials helped me to identify specific areas for self-development and educated me in different strategies and treatments to provide patients with better outcomes, with more research into evidence-based practice. In addition to Kolb's reflective model, I will also utilise Tanner's model of clinical judgment. Tanner's model of clinical judgment is based on decades of research and studies investigating the way healthcare workers think in practice. This model includes noticing, interpreting, responding, and reflecting. Several themes emerge from this literature. Two of the themes that I took particular interest in was the role of the teacher becoming the one that facilitates, who provides a safe, non-judgmental environment. And the second one I took interest into was encouraging active participation. An aspect of this model, which I did find particularly interesting and essential and is often overlooked, is setting a non-judgmental environment. Throughout my studies, there have been times where I've avoided asking questions and volunteering for scenarios out of discomfort. I will endeavour to ensure that my students that I may be mentoring, learning is no way inhibited by similar fear or embarrassment. I'll encourage them to always put their hand up and take the opportunity that will assist their learning. as soon I will be on the other end of the graduate paramedic internship program, and I must be capable of effectively facilitating the debriefing process. This is to assist in the professional development of future paramedic officers. Thank you.